Okay, let us continue with your tubular disorders. Let us begin with your acute tubular necrosis. Okay, acute tubular necrosis is a primary disorder associated with the damage to the RTE cells. Okay, now the damage to the RTE cells may be produced by a decreased blood flow. Decreased blood flow that causes now a lack of oxygen presentation going to the renal tubules, therefore resulting now to the development of ischemia. Okay, now aside from a decrease in blood flow, damage to these RTE cells could be a result also of the presence of toxic substances. Toxic substances such as your radiographic dye, broad-spectrum antibiotics, the presence of ethylene glycol, and the presence of heavy metals, especially your what heavy metal? Your cadmium. Cadmium is the most common heavy metal which is attributed in the development of acute tubular necrosis. Now, acute tubular necrosis is a condition secondary to other conditions that causes ischemic acute tubular necrosis, including systemic shock, traumatic injury, or surgical procedures. Okay, so your acute tubular necrosis is a secondary complication or secondary condition to other conditions such as these ones that causes ischemic acute tubular necrosis. Now, when we say systemic shock kasi, shock is a general term indicating a severe condition that decreases the blood flow throughout the body. Okay? Now, what are the examples of conditions that may cause systemic shock? Okay, ito yung mga cardiac failure. Okay, cardiac failure. What else? Bacterial sepsis. Anaphylaxis also. Lipat lang natin. Okay, so we have cardiac failure, bacterial sepsis, anaphylaxis, hemorrhage, massive hemorrhage, okay, kung merong bleeding. Massive hemorrhage, what else? And contact with high voltage electricity. Okay. So these are the conditions, okay, causing now to the development of systemic shock. Now, urinalysis findings of acute tubular necrosis includes mild proteinuria, okay, mild proteinuria, microscopic hematuria, okay, microscopic hematuria. What else? Very important, the presence of RTE cells or RTE cast. This is said to be the hallmark of urinalysis or laboratory findings of acute tubular necrosis. Okay. Why the presence of RTE cells? Okay. Bakit RTE cells yung pinaka-hallmark natin? Kasi the damage is concentrated to the RTE cells itself. Okay? Ganon din sa RTE cast. Okay? RTE cells and RTE cast, these are the hallmark findings of in the diagnosis of acute tubular necrosis. Okay? Now, as a result of tubular damage, a variety of other types of cast may be present also, okay, including hyaline cast, granular cast, granular cast, waxy cast, and broadcast. Okay, now let us proceed with your hereditary and metabolic disorders. Okay, now these disorders, okay, affecting now the tubular function may be caused by systemic conditions that affect or override the tubular reabsorptive maximum for particular substances which is normally reabsorbed by the tubules, or by failure to inherit a gene or genes required for tubular reabsorption. Okay, so number 1, we have there your Fanconi syndrome. Okay, Fanconi syndrome is very, tawag dito, magkaiba yan with your Fanconi's anemia. Okay, so wag kayong malilito, magkaiba yan dalawang yan. Okay, now this Fanconi syndrome, this disorder, okay, it is most frequently associated with tubular dysfunction. Okay, siya ang mas frequently encountered when it comes to tubular dysfunction. Okay, may problema sa reabsorption of substances. Okay, now it is consists of a generalized failure of tubular reabsorption, particularly in the proximal convoluted tubule. Okay, so it consists of a generalized failure of tubular reabsorption, particularly in the proximal convoluted tubule. Now dahil nandito yung pinaka problema sa part ng tubules natin, okay, the primary or the greatly affected substances or yung mga substances na commonly na napapass out sa urine is yung mga substances na supposed to be nare-reabsorb din ng PCP, such as your glucose, amino acids, what else? Electrolytes such as your sodium, phosphorus, potassium, okay, bicarbonates, and even your water. Okay. Now, the tubular dysfunction, okay, wait lang. Tubular reabsorption, rather. The tubular reabsorption may be affected by a dysfunction of the transport of filtered substances across the tubular membranes. Okay? So, ito yung mga problema. Number 1 dyan, it could be a result of dysfunction of the transport of filtered substances across the tubular membrane, or it could be a result of disruption of cellular energy needed for the transport of substances. Or pwede rin naman, okay, there could be a changes in the tubular membrane permeability. Okay, so these are the possible causes of the damage or the defect or dysfunction in tubular reabsorption in the case of Fanconi syndrome. Now, Fanconi syndrome may be inherited in association with, okay, so it could be inherited disorder in association with cystinosis and heart-valve disease. Okay. Or it can be acquired also. It can be acquired through exposure to toxic substances like heavy metals or outdated tetracycline. Okay, so it could be inherited or acquired, or pwede rin it can be seen as a complication of other conditions. Okay, so pwede siyang secondary complication of other conditions such as your multiple myeloma or renal transplant. Now, urinalysis findings in Fanconi syndrome are glycosuria with normal blood concentration, okay, normal blood concentration of glucose. Pwede rin mild proteinuria, together with mild proteinuria and aciduria. Okay? aciduria, a very low pH of urine, okay, due to failure of reabsorption of bicarbonate. Kaya nagkakaroon ng aciduria kasi nga there is a defect in the tubular reabsorption of bicarbonates. Kaya lahat ng bicarbonates napapass out lang na napapass out sa urine. Then next, we have your Alport syndrome. Alport syndrome is Alport syndrome. Alport syndrome. It is an inherited disorder of collagen production affecting now the glomerular basement membrane. Okay. Now it can be inherited as X-linked inherited disorder or autosomal genetic disorder. Okay, so most probably males are most likely to be affected by this syndrome. Okay, now in Alport syndrome, the glomerular basement membrane has a lamellated appearance. Okay, yung glomerular basement membrane natin, okay, it has a lamellated appearance with areas of thinning. Now, although there is no evidence of the presence of autoantibodies, okay, sa Alport syndrome natin. Kaya hindi natin siya ma-consider as autoimmune disorder. Okay? Now, bakit nagkakaroon ng Alport syndrome? Okay? Alport syndrome daw, okay, is actually a sequelae infection after respiratory infection, especially among the children, mga batang lalaking patient. Yung mga pediatric male patients natin, following respiratory infection, okay, pwede siguro viral infection ito, okay, pwede siyang actually mag-develop into Alport syndrome. Okay? Now, these patients may exhibit macroscopic hematuria. Okay, by the way, ito na yung ating urinalysis findings in your Alport syndrome. Okay, so the patients may exhibit macroscopic hematuria daw. Okay, and continue to exhibit microscopic hematuria. Kumbaga, lifetime na yan. Microscopic hematuria. And aside from this one, the hearing and the vision, tawag dito, pwedeng maapektuhan yung hearing and vision ng mga patients natin, yung mga children. Okay? Hearing and vision impairment may also develop in Alport syndrome. Now, the prognosis of this Alport syndrome may range from mild symptoms to persistent hematuria, yung sinasabi ko kanina, yung microscopic hematuria, and renal insufficiency, and later in life, it could actually develop into nephrotic syndrome and even end-stage renal disease. Okay? Now, let us move on with your uromodulin. Uromodulin-associated kidney disorder. Uromodulin-associated kidney disease. Now, this disorder, okay, is primarily an inherited disorder. Inherited na naman yan, caused by an autosomal mutation in the gene that produces uromodulin. Okay, now this mutation will now cause a decrease in normal uromodulin, okay, decrease in production of normal uromodulin that is now replaced by abnormal forms. Okay, so ulitin natin. Uromodulin-associated kidney disease, okay, it is an inherited disorder caused by an autosomal mutation in the gene that produces this uromodulin. Now, the mutation causes a decrease in production of this normal uromodulin, okay, replacing now it by abnormal forms. Okay. Now, this abnormal uromodulin is still produced by renal tubular cells, which will then accumulate in these cells, resulting now to the destruction of renal tubular cells. Okay.
Now, the mutation also causes an increased serum uric acid. Okay, it is associated with an increased serum uric acid, and then this increased uric acid, okay, could actually result into the development of gout. And then next we have your diabetic nephropathy. Diabetic nephropathy is currently the most common cause of end-stage renal disease. Okay, so it is currently the most common cause of end-stage renal disease and the most common cause of death of patients with poorly controlled diabetes mellitus. Okay, so it is the most common cause of death among patients with poorly controlled diabetes mellitus. Okay. Now, the damage to the glomerular membrane occurs not only as a result of thickening of the glomerular basement membrane. Okay, sulat natin, cause of damage. Okay, so the damage of the glomerular basement membrane, it occurs not only as a result of thickening of this glomerular membrane, but also because of the increased proliferation of mesangial cells and increased deposition of cellular and non-cellular material within the glomerular matrix. Therefore, this increased deposition and proliferation of these cells, okay, could actually result now into the accumulation of solid substances around the capillary tuft. Okay? Now, this glomerular damage is believed to be associated with the deposition of glycosylated proteins. Okay, it is believed now that the damage here is associated with the deposition of these glycosylated proteins, resulting now from poorly controlled blood glucose levels. Okay, now the vascular structure of the glomerulus may also develop sclerosis. Then next, we have your nephrogenic diabetes insipidus. Okay, now we all know that the urine concentration is regulated in the distal convoluted tubule and the collecting ducts. Okay, the urine concentration is regulated in the distal convoluted tubules as well as your collecting ducts in response to ADH, which is now produced by your hypothalamus. Okay. Now, in cases of nephrogenic diabetes insipidus, or it may be neurogenic DI, tawag dito, when the action of ADH is disrupted, either by the inability of the renal tubules to respond to ADH, we call it your nephrogenic DI. Okay? Nephrogenic DI, yun yung condition wherein yung tubules mismo hindi siya nagre-respond dun sa action ng antidiuretic hormone natin. Okay? Or failure of the hypothalamus to produce antidiuretic hormone, we call it your neurogenic DI. Dito ang problema na mismo is the production of antidiuretic hormone. Dito, unresponsive yung ating renal tubule sa antidiuretic hormones natin. Okay? Now, a problem here in the production, either production or unresponsive to ADH, will now result to excessive amounts of urine are being excreted. Now, nephrogenic diabetes insipidus, okay, can be inherited. It can be inherited as X-linked disorder, or it can be acquired from medications, can be acquired from medications such as your lithium, amphotericin B. Okay, it can be acquired from medications such as lithium and amphotericin B, or it may be seen as a complication of other conditions such as your polycystic ovarian syndrome or sickle cell anemia. Now, urinalysis findings associated with nephrogenic diabetes insipidus, okay, are those of low specific gravity. Of course, alam na natin yan. Low specific gravity, pale yellow urine. And the patient may also manifest polyuria. Okay, and then the possibility also of causing now false negative result for chemical test. Bakit mag-false negative? Kasi masyadong diluted yung urine ng patient. And then next we have your renal glycosuria. Renal glycosuria is an inherited renal disorder also, which exhibits now a generalized failure to reabsorb glucose lang. Okay, so glucose lang yung hindi na-reabsorb sa renal glycosuria natin. Unlike in your Fanconi syndrome, okay, yung pinaka-damage is the tubular reabsorption, primarily in the proximal convoluted tubule. Okay, so yung mga substances which are greatly affected there is yung mga solutes din na nare-reabsorb dapat sa proximal convoluted tubule. But this time, in your renal glycosuria, there is only a generalized failure to reabsorb your glucose only. Okay? Now, the problem here in this disorder is either due to, ito na yung mga cause of, yung mga causes natin. Okay? The problem in this disorder is either due to a decrease in the number of glucose transporters in the renal tubule, or it could be a result also of a decreased affinity of the transporters for glucose. Okay? The affinity of the transporters for glucose is decreased. Okay? Now, under normal conditions, glucose should not be present in the urine. Okay? Excessive amounts of glucose should not be present in the urine or should not be passed out in the urine unless the blood glucose levels exceeds now the tubular or rather the maximal tubular reabsorption capacity for glucose, which is 160 to 180 milligrams per deciliter. Okay? Now, but in the case of a patient with renal glycosuria, they have an increased urine glucose concentration with normal blood glucose concentration. Okay, so ito na yung pinaka-hallmark finding natin. An increased urine glucose concentration with a normal blood concentration of glucose. Now, let us move on with your interstitial disorders. Okay, now, considering now the close proximity between your renal tubules and the renal interstitium, the disorders affecting now the interstitium also affect the tubules, thus resulting in the commonly used term tubulo-interstitial disease. Okay, now the majority of these disorders involve infections and inflammation or inflammatory conditions. Okay. Okay. So the most common, okay, let us move on with your urinary tract infection, your UTI. Okay. Now this is the most common renal disease, okay, classified under interstitial disorders, okay, your UTI. Okay. Now, infections in UTI may involve the lower urinary tract. Okay, affecting now the urethra, ano ba yan? Urethra, urethra and the bladder. Or the upper urinary tract, affecting now the renal pelvis. What else? Renal pelvis, the renal tubules, and the interstitium. Now, the most frequently encountered type of UTI is infection of the bladder. Okay, otherwise known as your cystitis. Okay, ito yung pinaka mas common na na-encounter type of UTI, which is your cystitis. Okay, infection of the urinary bladder. In which case, if left untreated, this could actually progress to a more serious type of upper urinary tract infection. Now, cystitis is more often seen among women and children who present with symptoms of frequent urination, dysuria also, or the burning sensation while urinating. Dysuria, frequent urination, and ayun, yun lang pala. Okay, so ito yung pinaka-common symptoms manifest by patients suffering from cystitis. Okay, now urinalysis findings include the presence of numerous bacteria and WBCs. Okay, urinalysis findings may reveal the presence of numerous WBCs and bacteria, together with an increased urine pH. Okay, and then this is often accompanied with proteinuria. Okay, mild proteinuria and mild hematuria. Okay, and then it is accompanied by increased urinary pH. Okay. Now, let us move on with your pyelonephritis. Pyelonephritis, this refers now to the infection of the upper urinary tract, including both the tubules and interstitium, which can occur in both acute and chronic forms. Okay? So, unahin lang natin si acute pyelonephritis. Acute pyelonephritis. Okay, now most frequently, it occurs as a result of ascending movement of bacteria from a lower urinary tract, okay, going now to the renal tubules, going further to the renal tubules, and into the renal interstitium. Okay? So when we say acute pyelonephritis, this refers now, or rather, this occurs as a result of ascending movement of bacteria from a lower urinary tract going to the renal tubules and into the renal interstitium. Okay? So sabi natin kanina, pyelonephritis is the infection po of the upper urinary tract, including both the tubules and the interstitium. Okay? Now, the ascending movement of this bacteria from the bladder, okay, and dito yung bladder natin, it is now enhanced with conditions that interfere with the downward flow of urine. Okay? So, remember, di ba? Ang urine natin, physiologic mechanism yan ng body natin to expel this bacteria sana. Now, dahil merong nag-interfere dun sa normal urine flow natin, pababa, sana may chance na ngayon yung bacteria natin na makamove upward sa going to the renal tubules and then later on into the renal interstitium. Okay?
Okay, so dahil merong nag-interfere dun sa downward flow of urine coming from the ureters going to the bladder. Okay? Now, aside from this interfering with the downward flow of urine, it could be a result also of an incomplete emptying of the bladder during urination. Now, examples of this condition, yung mga nag-interfere dun sa urine flow natin, okay, it includes obstructions including renal calculi. Pag merong renal calculi, okay, renal stones. What else? Kapag pregnant yung ating patient, pregnancy. Kaya kung mapapansin nyo, yung mga pregnant females natin, they are most likely to prone to develop UTI. Okay? So, common sa mga pregnant females yung magkaroon ng UTI because of these obstructions. Okay? And then, aside from renal stone and pregnancy, pwede rin, it may be due to reflux. Reflux of urine from the bladder going back to the tubules. We call this condition your vesico-urethral reflux. Okay. Now, in acute pyelonephritis, patients with acute pyelonephritis may present symptoms like frequent urination, burning sensation during urination, and they may also experience lower back pain. Now, urinalysis findings of acute pyelonephritis are very similar to those seen in cystitis. Although the finding of cast, yung mga bacterial cast natin, WBC cast, mas makikita mo yan in cases of acute pyelonephritis kasi sa interstitium na yung mismong damage. Unlike in your cystitis, nasa urinary bladder lang yung infection. Okay? So, walang formation ng cast na nangyayari doon. Okay? Now, the pinaka-hallmark finding natin in your acute pyelonephritis is the presence of WBC cast. Okay? Pwede rin makakita ka ng bacterial cast. Okay? Bacterial cast and WBC cast, signifying now that there is an infection within the tubules. Okay? Now, pwede natin gamitin yan as a primary diagnostic value for both acute and even chronic pyelonephritis. And then next, we have your chronic pyelonephritis. Chronic pyelonephritis now, okay, it is now a more serious form or a more serious disorder that can result in permanent damage to the renal tubules and a possible progression to chronic renal failure. Okay, so it is a more serious form of pyelonephritis. Okay. Now, chronic pyelonephritis, it is associated daw with congenital urinary structural defects producing reflux nephropathy. Okay? Reflux nephropathy that are the which are now the most common or rather most frequent cause of chronic pyelonephritis. Okay? Due to congenital structural defects. Okay? Congenital structural defects. Now, this structural defect, okay, could actually result to causing reflux nephropathy. Okay. Now, these structural abnormalities may cause a reflex between the bladder and the ureters or within the renal pelvis, affecting now the emptying of the collecting ducts. Okay. Now, the urinalysis findings of chronic pyelonephritis are very similar to those seen in acute pyelonephritis, particularly in the early stages. Okay. However, yung urinalysis findings natin kay chronic pyelonephritis, how will you differentiate it from acute pyelonephritis? Madali lang. Dahil sobrang tagal na nung progression ng damage, pwede kang makakita ng iba't ibang uri ng cast, like your granular cast, waxy cast, and even broad cast. Remember, broad cast is an indication or a signal na meron ng renal failure. Diba? Tinawag natin yan as renal failure cast. Okay, so pwede natin gamitin as differential finding C broadcast or even waxy cast to differentiate it from your acute pyelonephritis. Okay. Then aside from this variety types of cast, these are usually accompanied by an increased proteinuria, hematuria, and even proteinuria, hematuria, and decreased renal concentration or decreased renal concentrating ability. Okay. Then next, we have your acute interstitial nephritis. Acute interstitial nephritis is primarily associated with an allergic reaction. Allergic reaction to medication that occurs within the renal interstitium, possibly caused by the medication binding to the interstitial protein. Okay, so when we say acute interstitial nephritis, ang unang maiisip natin agad, it is primarily associated with an allergic reaction to medications. Okay, now these medications commonly associated with acute interstitial nephritis include penicillin, methicillin, ampicillin. Okay, sulat natin, penicillin, penicillin, methicillin, penicillin, methicillin, penicillin, methicillin, ano pa yon? Ampicillin, okay, sulfonamides, basta mga antibiotic yung mga yan, okay, sulfonamides, what else? Okay, cephalosporin, antibiotic also, cephalosporin, okay, mga non-steroidal anti-inflammatory drugs, okay, thiazides and diuretics, okay. Now, the symptoms relating to renal dysfunction include oliguria, okay, ito yung mga simptomas ng acute interstitial nephritis, oliguria, edema, what else? Decreased renal concentrating ability, okay, decreased renal concentrating ability, and a possible decreased glomerular filtration rate. Okay, now the patient may also present initial symptoms like fever and skin rashes. Skin rashes kasi nga merong allergic reaction. Now, yung acute interstitial nephritis natin, it is a transient condition lang naman. Especially if you will discontinue the offending medication and administration of steroids to control the inflammation. Okay? However, in acute interstitial nephritis, supportive renal dialysis may be required to sustain the patient until the inflammation subsides. Now, urinalysis findings include, okay, urinalysis findings in acute interstitial nephritis include hematuria, okay, hematuria, mild to moderate proteinuria, numerous WBCs, most particularly your eosinophil, the eosinophil type, the presence of WBC cast also. Okay? And then, lagi niyong tatandaan, may WBC cast, pero walang bacteria. Okay? No bacteria. Now, the presence of increased eosinophils by using what stain? Your Hansel stain. Okay? It may be useful to confirm the diagnosis of acute interstitial nephritis. Kasi yung eosinophil natin, yan ang pinaka-hallmark findings natin sa associated with acute interstitial nephritis. And then next, we have your renal failure. This would be our last topic for this one. Okay. Renal failure exists in both acute and chronic forms. Okay? In conjunction with many of the previously discussed disorders. Diba? So, sinabi natin paulit-ulit yung mga na-mention nating glomerulonephritis and etc. It could actually progress into end-stage renal disease. Okay? Yung renal failure natin. Okay? Now, your renal failure may be a gradual progression from the original disorder to chronic renal failure or end-stage renal disease. Okay? Now, the progression to end-stage renal disease is characterized by a marked decrease in